If you need medical care, hospitals are now required to tell you how much it will cost before you go. While this law isn't new, a lot of people just don't know that it exists. I'll explain your rights, how to find these estimates, and how local hospitals are responding. Choosing between physical pain and financial pain. A catch-22 for a lot of people in this country, including Christine Hanna.
$1,000 is not something I would handle. If they had told me that, I would have said, I'm not even going to try rehab.
She was slapped with a $1,000 bill after being told her treatment would cost about $90.
Can you guys afford that?
No, we can't afford that. Not at all. We're definitely like poverty level.
Like so many others, it's because of stories like this the federal government has made changes. Hospitals are now required, and they have been since 2021, to post the cost of their services.
We worked with a third party to make sure that we were compliant.
The hospital price transparency rule requires hospitals to list their prices in two ways. First, with the machine-readable file, like an Excel spreadsheet that lists all of the hospital's charges and negotiated insurance rates. Second, with a program that's easy for consumers to use and understand. I wanted to see what our local hospitals did for you, so I reached out to each of them. Chesapeake Regional Medical Center created a price estimator tool. I sat down with Sonia Mead-Settles, Director of Patient Access, to talk about it.
We have different options available for the patient to select, and it will produce an estimate of potential costs. And the key word here is estimate.
An estimate, Mead-Settles says, because service, health plan coverage, and deductibles all play a role. She walked me through what it would look like if you tried it yourself right now.
So if you go to the ChesapeakeRegional.com website,
you will see an icon that says Bill Estimator. Click on that.
And here's where you can enter if you actually have insurance or if you do not have insurance, and if it's a cosmetic procedure or not.
We chose an ankle x-ray from the list. After entering the information, we were given an estimate of $495.53, as well as a self-pay discount and the cost without insurance.
Our focus is on educating the patient and providing available resources.
The hospital transparency rule lets consumers take Chesapeake Regional's price and compare it to other hospitals. While the idea is to create competition and potentially lower prices, healthcare is still expensive.
I get emotional about it. It's a crime.
Dr. Keith Berger has treated patients in local hospitals over the years and owns a private practice.
If you didn't know it was going to cost you, say, whatever, $4,000 at a hospital versus $400 in an office, how would you know to even ask the question?
Dr. Berger says he wants more people asking those questions. In fact, he testified before the General Assembly in Richmond, pushing for a transparency law in Virginia. It was passed and goes into effect July 1st, 2023.
So that was a step forward because with the state law, in addition to the federal rule, they felt there was more they could be enforced.
He says within the hospital system and private practice, education is key to change.
If you don't know something, you can't take advantage of it, or you can't be prepared for it.
Many hospitals like Chesapeake Regional have financial assistance teams as well. You can reach out to your hospital directly for more information. We'll link their information for you on WTKR.com to make it easy, but there is much more of this conversation to cover. Thursday morning on News 3, I'll share reports looking at hospital compliance and the penalties that these institutions can face if they aren't abiding by federal guidelines. I sit down with advocates and Sentara Healthcare to talk about this further. The Cost of Transparency Part 2, Thursday morning.